You are recording.
All right. Well, welcome everyone to our 2020 Alaska Chapter annual business meeting. I want to say good morning, good afternoon, and good evening, depending on when you are listening to this recording. But I do want to start out with a formal land acknowledgement to show appreciation for the past and present Indigenous stewardship of the lands we now occupy. We recognize that this virtual meeting is being hosted and recorded on the Dena'ina El Nina. Anchorage is the Dena'ina homeland. We hope this recording allows a broader chapter membership to tune in at your convenience as 2020 comes to a close. We apologize in advance if there are any technical difficulties as we try to coordinate multiple speakers for this Zoom recording. I cannot advance slides. Okay, there we go. So we will start with introductions to our Alaska Chapter Executive Committee. For those of you who do not know me, I'm Anna Ogina. I'm your current chapter president. My term started this January 2020. We have 3-year terms that are renewable for 2 terms. The rest of our executive committee is comprised of our Vice President, Jody Budo, our Secretary Treasurer, Kevin Collins, our past president, Lily Liu, who completed her 2nd term in December of 2019 and has unfortunately relocated to Chicago, Illinois, and started a new chapter over there. She will always be an Alaskan chapter member in spirit, and she has definitely stayed engaged with us this year and since her move. We've added 2 other committee or board members, an early career representative, Matt Cerna, who took over for Teresa Dulski when she also moved out of state. And we added an out of Anchorage or rural representative, and that's Marna Schwartz in Juneau. And then we have our chapter executive director extraordinaire, Dale Knudsen. So typically we would approve and vote on approval of the 2019 annual meeting minutes. But because this is recorded, what we're going to do is have an attachment of the minutes included with the recording link to be posted on our AAP Alaska chapter website, which is undergoing a redesign. We went from a .org address to a .com. And we have a new webmaster, and all of that is in progress. So stay tuned for a new website. Okay, so we will move right along with our treasurer's report. However, before I lend the mic to Kevin, I'd like to give a special thanks to Jody, who was our previous secretary treasurer, for reinstating our nonprofit status, our 501c3, so that we could finally apply again for grants, for grant funds. And this was a multi-year effort to accomplish this with the accountant she found for us. So kudos to you, Jody. And other than that, I'm going to have Kevin take it away.
All right, thank you very much, Anna. And this shouldn't take too long. So reviewing the income for the chapter, we have sources primarily from dues and then grant income. From dues, expected income is $7,000, and then the grant income is a little over $45,000, and that runs through May of 2021, and we'll go through that on the next slide as well. The total expected projected expenses is just a little under $7,000. The biggest cost from staff and then insurance. We can go to the next slide.
Yep.
The financial reserves, that's actually looking at the bank statements from this week. It's actually a little over that. A little over 29,000 in reserves and savings. And then when we go through the specific grants, For 2021, we have an ECHO project grant at 25,000, First Line grant at 10,000, e-cigarette grant at 1,000, and Finish Line grant at just under 10. So, and that's it, short and sweet.
All right, now we get to move over, to our chapter champion updates. I'm going to go down this list so that everyone can hear on the recording. For Smoke-Free Homes, we have Melinda Ratkoff. This is actually kind of extended into just more than tobacco, into vaping and marijuana. We have for immunization, Roz Singleton, School Health, Patty Clay, Child Maltreatment, Barbara Knox, Adolescent Health, Rachel Lesher, Disaster Preparedness, Jessica Arrowsmith, Oral Health, Alyssa Rossier, Environmental Health and Climate Advocacy, Amy Vagadis and Mara Gotchik. Diversity, Equity, Inclusion is Tony Biskup. Breastfeeding, we have Heidi Koslow. Advocacy, Amy Dressel. Pros, Jody Budo. Early Hearing Detection and Intervention is Joe Livingston. CONACH, or the Committee on Native American Child Health, is Mara Gotchik, and Value-Based Payment is Thad Woodward. We did gain 3 new champions basically this year with breastfeeding, diversity, equity, inclusion, and oral health. But we do have 2 that are stepping down, and that's Roz for immunization and Joe Livingston from EHDI. So unfortunately, Dr. Ratkoff had a meeting conflict, so I'm gonna try to do her slides some justice and go over through e-cigarette and smoke-free homes. So Melinda underwent some formal training from the AAP in July via Zoom. She's including an AAP resource here on e-cigarette curriculum that includes a focus on addressing youth e-cigarette prevention and cessation based on current evidence and best practices. The AAP Alaska was awarded a chapter grant to be used to create educational materials that we'll talk about briefly later. And then we're planning a pediatric grand rounds in January or February on this topic. In Anchorage, an ordinance of the Anchorage Assembly ended the exclusion of electronic cigarettes and vaping devices from the excise tax on tobacco products. An email was sent to Assembly members prior to this hearing in September, and the Anchorage Assembly passed the ordinance to end the exclusion of electronic smoking products from the municipal tobacco tax of 55% of wholesale cost, with the amendment to include all devices and liquids with a 10-0 vote. They exempted marijuana shops, however. There is an article attached here on the association between youth smoking, electronic cigarette use, and coronavirus disease. If a person who smokes catches COVID-19, they are more than twice as likely to develop a severe case of COVID-19 than those with no smoking history. This means if a person smokes and catches COVID-19, they are more likely to be admitted to the intensive care unit, placed on a ventilator, or die from the illness. Menthol and other flavorings in tobacco products, including e-cigs, can also make lung infections worse. Tobacco use increases levels of angiotensin converting enzyme, or ACE2, which is an enzyme that helps the COVID virus attach to cells in the lung once it enters the body. Smoking and vaping damages the cilia, which makes it easier for the coronavirus to enter the lungs. Smoking and vaping damage neutrophils and macrophages, which makes it harder for the body to fight viral infections. Many tobacco flavorings, including menthol, affect how well lung and airway cells can fight infections. Well, this underscores the reason we should be doing some screening. And when we ask these screening questions, we don't just ask if you smoke or chew tobacco. You have to explicitly ask, do you vape, do you use e-cigs, or do you Juul? And if you have any questions, please do contact Melinda at her email here specified. Next, we're going to press play for Roz's recording on immunizations.
This is Rosalind Singleton sharing with you about immunizations. There's several big vaccine issues currently. The COVID pandemic led to an initial decrease in immunization rates across Alaska, but there's been a rebound because of provider vigilance in their patient population, and we need to continue this. The Alaska Vaccine Assessment Program, or AVAP, has had a year of success. The 2021 assessment was set for insurers. All insurers are paying. We're fully funded, and we have added flu coverage this year. A big thank you to the state and their work on AVAP. The AAP chapter had a flu vaccine challenge, which several practices participated in to raise flu vaccine rates. Just a quick update on child respiratory diseases in 2020. There have been actually very few flu cases in the state, including 0 cases at ANMC recorded, and you can see the lower red line is where we are currently with flu. Similarly, after a large RSV outbreak last spring in YK Delta, our respiratory surveillance has shown very, very few respiratory hospitalizations in children less than 5 in YK Delta and ANMC. This is probably due to social distancing from COVID. The 2020-21 Alaska Synergist recommendations are out, and there's no major changes in the eligibility criteria. The dates are November 23rd to May 15th. And last of all, I'd just like to say there is hope in the future for a 1-dose Synergist in the next few years. There's a product currently under investigation that lasts 5 months. You all know that Pfizer and Moderna COVID vaccine are here. Moderna was just approved by the ACIP on the 19th yesterday, after a FDA meeting on the 18th, which approved an EUA. Pfizer and Moderna are both mRNA vaccines with efficacy about 95% in phase 3 trials in adults. Pfizer requires ultra cold storage, while Moderna requires cold storage in freezers. Pfizer is 16 years and older, and Moderna is 18 years and older. The second dose of Pfizer is at 21 days. The second dose is at 28 days for Moderna. Both of them, the initial vaccinees, are healthcare personnel and long-term care facility individuals. The question I get asked the most is, Roz, will you get the COVID vaccine? And just so you know, the answer is yes. What's the most important thing we as pediatricians can do to support COVID vaccination and end this pandemic? First of all, we can make a strong recommendation as a trusted health professional. Second, then we can answer people's questions. Best wishes to all of you as you continue the important work of keeping our children and communities safe. Thank you.
Thank you, Roz. So after many years, Roz is is going to be stepping down, as she is going to be retiring in a couple of years. She's given us years of outstanding service. And she's interested in a succession plan for her role, which could involve multiple, like a shared role, essentially. So, so if you're interested, please do let us know. Okay, next up. Sorry, guys. There we are. Patty, you are up.
So it's obviously been a weird year for school health. And so it's kind of not business as per usual. So in the beginning, we worked pretty closely with the school nurses to kind of answer the questions and come up with algorithms and guidelines. Because the biggest fear was when kids come back to school, what are the school nurses going to do when 80 children per day show up there with symptoms? Needless to say, that has not really been an issue yet for ASD. We will see if that does become an issue. But the nurses and health services with ASD have had a lot of time to prepare for it. I was lucky enough to go on a tour with the superintendent and some media people to see what they had done at one of the elementary schools. And so I think we're just trying to stay as involved and trying to remain a resource for the schools, because if they do open, I think they're going to need a lot of support from AAP and community pediatricians and kind of next steps. We'll see how it goes. If anybody wants to be involved with that too, let me know, because I get a lot of questions from the health services kind of department at ASD and definitely answer them to the best of my ability. But anybody who has a strong interest, you can always let me know too. Okay, you can go to the next slide. And then before the pandemic happened, which feels like it was a million years ago, and I don't even remember this, but basically the ASD had started a pilot with PM Pediatrics of doing telehealth services in some of the schools, which created quite the ruckus, I think, in the pediatric community. So we had a meeting with ASD, with the superintendent to discuss that. The trial has obviously been stopped for now, so nothing's kind of coming out of that. But I think several pediatricians were involved and knew about this with a lot of concerns for delivering kind of telehealth, just funny now looking back, but delivering telehealth to elementary students in school. And whether that's going to reopen, we really don't know, but I can definitely keep you guys updated.
Thanks, Patty. Also, you guys did a great pediatrician panel. It was you, Melinda, Kevin, and Lily. You guys did a presentation for the Anchorage School District school nurses on just basically all COVID-related things and special considerations, which I think was very well received. So thank you for that.
Thank you. Yeah, and I think I have a feeling in the springtime if schools open that will probably happen again because things will be changing. So we will probably reach out to the same people, but again, if other people are interested, they should reach out as well.
Okay, thank you. Next, we have Barbara Knox.
Welcome. I will tell you that 2020 has been a dismal year for the children of Alaska in regards to child maltreatment. The inpatient consults at Alaska Native Medical Center and at Providence have actually gone up by 205% in comparison to last year's numbers. And this really reflects an increase that we're seeing in serious physical abuse cases and in serious neglect cases. So I think it really mirrors what you're seeing in the general pediatric offices as well, but these are cases that are coming in, the big and the bad, and requiring admission. Overall, I really wanted to emphasize that numbers to the Office of Children's Services are down significantly in 2020. But even though they're down, what's coming in is the big and the bad. So the serious cases are escalated. I just wanted to give you kind of a rundown of some numbers. So in 2020, thus far, we've seen here at Alaska Cares 953 children. Remember, the reporting numbers are down. So we have a lot of kids that just haven't come to our attention yet because schools are not going on. And that's a huge volume of mandated reporting requirements coming in. In 2019, we saw about 1,000 children. And then in 2018, about 988. So when you look at that, despite the Office of Children's Services having such decreased reporting numbers, we're still seeing kids. And the 2019 numbers, now the 2020 haven't been run yet, but I want you to look at this. We're seeing about 70% sexual abuse cases for maltreatment in Alaska and about 20% physical abuse and 10% neglect. What I want you to understand is that those numbers are really skewed. We should be seeing definitely about 50-50 physical abuse and sexual abuse cases, as well as we should have at least 35% neglect that we're seeing. So I think what is being reflected is that we're missing physical abuse and neglect in the state. And so that's something that we'll focus on. And I think we'll see if 2020's numbers shake out a little bit differently in the percentages. One thing I did want to focus on is what's happening to Alaska's children because of the fact that the schools have been closed in 2020 and that the kids have predominantly in many areas been stuck at home. We've certainly seen the financial insecurity and the unemployment causing stressors in those families. And with people not seeking care, medical care, with the reduction in home visitors because of COVID and not having people in school for the most part, we've had that drop in mandated reporting. And so if you go to the next slide, what you can see is that overall, go ahead, Anna, you can advance.
Okay.
What you can see is these are the numbers. When you look at the numbers of reports received by the Office of Children's Services in the state of Alaska, you can see that they have significantly dropped in 2020 when compared to what they've received in 2019. So they're down about 30% overall. And so we know that kids are being maltreated and are not being picked up because of lack of just mandated reporters with eyes on those children. And so I think as schools return, as people start going back to the doctor, we'll see how these numbers actually pick up and adjust in the state. Next slide, please. So what I wanted to do is just show, okay, so people keep looking at, we know that we're hearing nationally in the news about COVID and maltreatment. So what's actually happening? Basically, everybody nationwide saw that with COVID-19, there was an uptick in severe physical abuse cases. This really mirrors what we saw in 2008. During the recession in 2008, we saw a huge increase in abusive head trauma cases. Certainly we're seeing right now in 2020 an increase in severe physical abuse cases, also in child neglect, and our sexual abuse numbers have certainly increased. And so what we know is that when kids are stuck at home without eyes on them, the numbers of sexual abuse acts increases, and also the risk of online perpetration, because kids now are having so much more time online unsupervised, and especially with having to do online schooling, they have more access to ability to get into trouble online. From the 2018 data, what we know is that about 16% of reports that were received of maltreatment were from the family or somebody else close to the child, and about 80% of the perpetrators were the victim's parent. In 2018, there was about 1,700 kids who died of child maltreatment. We know that in the COVID area, this national trend has been increased ER and hospital admission cases for severe abuse. I also think that it's important to note that half of all callers to the National Sexual Abuse Assault Hotline were minors, and 79% reported living with the perpetrator. Next slide. So just one thing to point out here, just as something that we can all do as pediatricians, is when you're doing your telemedicine visits, screen for the safety and social determinants of health by asking about intimate partner violence in the house, child safety, is there exposure to drugs and alcohol? We're off the charts right now in the state of Alaska with kids who are testing positive for opiates and methamphetamine. So things to be aware of. And then also behavioral changes. The other thing I wanted to say is just don't forget to ask, especially in that infant population, about the sentinel injuries. Any bruises noted on the baby, any blood coming from the child's mouth. Next slide. And you can see that that literature is pretty clear that infants under the age of 1 should not have bruises on their body, especially those under 6 months of age. And if they do, I think it's really important to make sure that we're initiating those child maltreatment evaluations. We did establish protocols for physical abuse evaluations, and we've disseminated them to all of the programs across the state that are doing physical abuse work, and we're happy to share that with any of the statewide pediatricians who want those. Just feel free to email me those and I'll shoot you the protocols back. We also have them for the drug endangered children, but I just wanted to make sure that people knew the 10-4 clinical decision rule, because that basically has a 97% sensitivity and an 84% specificity of predicting abuse. And if you flip to the next slide really quickly, that just shows everyone where the abnormal locations are for bruises on children under the age of 6. Okay, next slide. And then one last thing I wanted to point out, and that is human trafficking or child sex trafficking in Alaska. You can see on this map, there's 3 hot spots for it. It's Anchorage, Fairbanks, and Juneau. Next slide. The thing that I wanted to say is that this does happen in the state of Alaska, and one push that we've made overall from the child maltreatment standpoint is to really put screening questions in. Most of the children who are being sex trafficked in Alaska know their trafficker, and here's what happens in Alaska. It's not the organized child sex trafficking that you think of. It's basically that child gets trafficked for money or in exchange for money or drugs or alcohol. Next slide, please. And I just wanted to end with, these are the 6 child sex trafficking screening questions that can be asked. And if you have 2 or more that flag positive on there, that puts that child at significant statistical risk of being trafficked. So I'm happy to share any of this with any of the statewide pediatricians. But thank you all so much for all your work in this field.
Thank you, Dr. Knox, for that update. Next, we have Rachel Lesher for adolescents.
Hi. Okay, so you could flip to the next one. So this is just a rundown of some of the things that we tried to accomplish in this unprecedented year. But we've been working with the Department of Health, Social Services, Adolescent Health Department. So they just, I'm gonna change my screen really fast so that I can look, there we go. So the 2020 Adolescent Health Tribal Action Plan for Alaska was finally distributed and produced. It's available, or it's going to be available on the I Know Mine website, which is just being revamped. The Tribal Action Plan was something that we worked on in 2019 with a big, long day project from stakeholders all across the state. And so the plan was finally completed recently. It is more like an action plan. So there's strategies, and it really kind of shows where the problems are and some potential strategies for fixing it. I think of it more like a step 1. And I'm hopeful that kind of what we'll be able to do with the information is kind of go towards something like what we have for early childhood development. There's still the youth-friendly clinics project that is ongoing. There is the recommended adolescent health screening, which I just put a little screenshot of. And Jenny Baker is the contact for that, and she's still working on getting more clinics involved in the youth-friendly clinics project to basically make adolescent health more of a priority in primary care pediatric clinics. I've also been working with the Society of Adolescent Health and Medicine. I'm a member of the Northwest Pacific Regional Chapter. So if people are interested and want more information, you can be involved in that. They put out a newsletter 4 times a year, and then they send updates about different trainings that are available. Most of them are virtual trainings. And they've been doing a lot for addressing equity and racial justice this year for adults, specifically geared towards adolescent health. And then there's also the LEA Fellowship, which I am a regional administrator or mentor for. The LEA Fellowship is something that people can be involved in. And there's information about how to get into, if it's a year-long fellowship, which you can do from your computer. And I've lost, oops. Oh, there it is. For some reason, I'm not seeing the slides anymore. Here we go. As far as transgender health, so we were able to get legislation passed in Anchorage to ban conversion therapy for minors. It's only, I think we're only like one of the first 20 cities to be able to get this passed, which has been shown to be harmful for minors. Conversion therapy is using therapy to try to change someone's gender identity or sexual orientation. So that was exciting. We did participate as far as AAP by Alaska chapter by supporting that legislation. We also have expanded the work group through ANMC and SCF to improve trans health in the Alaskan tribal population. So now it's not just Anchorage based, we also have members from the Valley and from Southeast or from Kenai Peninsula. And then the health needs assessment for the statewide LGBTQ plus health needs assessment was completed. Identity Alaska led that charge along with several partners, including me being involved with that. So the survey results are now being analyzed. The health needs assessment was established several years ago and finally has been completed. And I think we'll get more information from that next year. And then with the Alaska Eating Disorders Alliance, I joined the board of that. And some of the things we've done are requesting some changes to the youth risk behavior survey so that eating disorders can be added. Currently, we have no knowledge of the prevalence or risk of eating disorders in Alaska youth. And so hopefully if we're able to get some questions added to the YRBS, we'll have some understanding of what the prevalence is. We've also been able to obtain grant funding to offer trainings on eating disorders throughout the state. And there's some live webinars and support groups that are available. So if you'll go to the next slide. So hopefully for 2021, we'll be able to continue surviving this pandemic. To get the youth risk behavior survey, they were going to be administering that this spring, but they moved it back to the fall. So just be on the lookout for that because they'll be wanting to try to increase participation. They moved it to fall because they figured that schools aren't going to be able to really help with getting that participation out in the spring. Then there's the Youth Friendly Clinics Initiative. So there's Jenny's email. And then for trans health and LGBTQ health, Identity is now partnering with Full Spectrum Health here in Anchorage. And so they will be offering more gender affirming and queer affirming healthcare, specifically through Identity and Full Spectrum. I'm not sure like how young they're going to be seeing patients for gender affirming care, but I'm going to be kind of helping with some of their trainings, hopefully. And then we'll get more information on the health needs through the health needs assessment. With eating disorders, there's going to be several educational series and outreach offerings for clinics. There are already some webinars and live trainings that are available, and you can go to the Akita website to get information about that. And then in December, there will be a DBT dialectical behavioral training conference. That will be, I think, a 2-day virtual with maybe some in-person conference, depending on what's happening with COVID by that time. And then with sexual and reproductive health, we're looking into some educational opportunities to increase that given our high risk of STIs and intimate partner violence and teen births here in the state. So I'm not sure what we'll be able to get done with that next year, but that's where we are. And then that is just the recommended guidelines for clinical preventive services. So that's kind of what's being looked at with the youth-friendly clinics. And then I think the next thing I put up was the 5 areas of focus for adolescent health. That's from the Department of Health from the state. And so I think those are all the things that I included. Maybe there's another. Oh, and that's my Gmail address. It's not really the best one. I don't check it very often.
I
My
can change it when we publish the slide. Sorry, Rachel.
Okay.
Just let me know which one you'd like me to send it to.
Okay, yeah, I'll send that. So that's it.
Thank you, Rachel. Jessica Arrowsmith can't be here today to discuss disaster preparedness, but she did include a slide. She basically wanted us to know about the Take 5 to Survive link, and that the AAP and the Emergency Medical Service Committee is putting together a MOC Part 4 module so that we could potentially get 25 points for MOC points on disaster preparedness for office-based pediatricians. And if you have any questions about that, you can contact Jessica. Next, we have Elisa for oral health.
Hi, my name is Elisa Rozier. I'm a pediatrician in private practice in Ketchikan. So I just started, I just filled the role of a COHA, the chapter oral health advocate. It's something that I've wanted to do for years, and grateful that I have the time. And with Zoom linking us, I feel like I'm better able to do it. So just started October and November, there was a oral health knowledge network Zoom call. I think that's a monthly call, monthly national call or meeting. And then went to the first COHA oral health advocate Zoom meeting, national, in December, and was able to make a few contacts there. And then locally here in Ketchikan, I was able to get a wellness grant through my private practice for the kids of Ketchikan, and got $2,000 and did 100 bags of full-size dental hygiene products. So toothbrush, tooth floss, mouthwash, a 2-minute timer, and toothpaste. And I've handed out like 75 of them. So, and kids love them. It's like I'm giving them the best present ever when they get that. It's so cute to see. All right, next slide. And that, I'd prefer the Pacific Pediatrics one, so we could change that. I was also able to speak with a dentist in Minnesota he's like chair of the AAP oral health section, and we just kind of went over the job description, and he got me in touch with a couple of pediatricians, one in Pennsylvania, another in Oregon, I think. So I have the job description, and we're actually kind of going to start modifying the job description or updating the job description of COHA's as kind of the first work that I'm gonna be doing. So thank you.
Thanks for that update. Okay. Next up, we have a new chapter champion role. It's diversity, equity, and inclusion. And this topic has become so poignant, especially this year amidst, the pandemic and the economic crisis and racial and social injustice. So we really are grateful that Tony Biskup has stepped into this role. So Tony, take it away.
All right. Well, I just started, so I don't have a lot to say, but I'm really excited about this role. I'm also would love, if people have ideas or ways for me to be helpful. I'm open, but I literally just stepped into this role. So yeah, but the AAP developed this council, the Diversity and Inclusion Council, in 2017. And I think, so they published their statement initially in 2017, but then, and this link is for the statement published in the Journal of Pediatrics. And one of the things I love about the AAP is that they are very active in really promoting health and health equity, and dismantling disparities. So, and dismantling inequities. And I think more so than a lot of medical organizations. That's one thing I really respect and appreciate about the AAP. So I'm happy to answer any questions or do talks about specifics related to how racism or bias more generally impact health in children. I did just at the request of the Alaska Humanities Forum, Anna put this on here, so I'll just mention it. I did put together a podcast series, a 3-part series on structural racism, and it's divided into 3 episodes, one on racism in education, one on racism in medicine, and one on dismantling racism. And so I was able to invite guests to be the speakers for this podcast. And actually, we have, for the racism in medicine, 2 local docs, Doctors David Baines and Allison Kelleher. They were the guest speakers on the racism in medicine. So it's conversation style, not lecture style, but they're going to be great. We just finished recording them. And I guess that's all I have to say. So I'm looking forward to growing into this role. Thanks.
Thanks, Tony. We're really excited for this role. We just want to continue to help children grow up in a world that cherishes them, fosters safe environment, and frees them from bias and discrimination. So yeah, I'm excited for this next year. Okay. Next, we have our breastfeeding section. Unfortunately, Heidi Koslow, she's our new chapter champion. She's also the president of the Alaska Breastfeeding Coalition. And so we're excited to finally fill this role. It was vacant for several years. And through being our chapter champion and the Breastfeeding Coalition, Heidi strives to inspire, empower, and support families in their breastfeeding goals through education and advocacy and systems change. She participated as a panelist on an ECHO presentation in the early days of COVID. She participated on the U.S. Breastfeeding Committee on Policy and Legislative Changes, both in Alaska and on the national front. And also, as the chapter breastfeeding coordinator, she participated in the kind of nationwide Zoom virtual calls as well. She presented presented to the Defense Health Agency this evidence-based practice guideline entitled Breastfeeding Support of the Active Duty Servicewoman in the Military Health System. And this led to participation in the ongoing procedural instruction to make lactation support a consistent policy on a worldwide level across all military branches. So that's great. If you guys have any questions for Heidi, please contact her at her email. Okay, next, I don't think Mara was able to join us. She does have a new baby that she is caring for, so I'm happy to fill in. Mara represents us for the state of Alaska in District 8 on the Committee of Native American Child Health. And actually, Alaska was supposed to be the Conach site visit location for 2020. Obviously, this has been postponed until at least the fall of 2021. But they're going to do, they're going to attempt to do virtual site visits instead. Additionally, the International Meeting on Indigenous Child Health will not be held in 2021. Again, there will be a series of virtual talks in its place, and more info to come on that. The next planned conference in its traditional format will be in 2023 in Canada. Mara also lists how to get signed up for the Indian Health Special Interests Group, the IHSIG listserv, which has a lot of great information and CME opportunities as well. Mara, along with Amy Vagetis, they are our climate advocates. She is also the CONACH liaison to the climate advocacy group and will be helping to write an AAP environmental justice position statement. She notes that Alaska is warming at a rate faster than the rest of the country. Children in Alaska are at risk of adverse health outcomes due to climate change, including, but not limited to, air quality concerns, increased pollen counts, new diseases, for example, increase in vector-borne diseases currently seen in warmer climates, change in traditional hunting and gathering resources, erosion in coastal communities, extreme weather events such as wildfires. There's a concise state EPI bulletin on this topic from January 2018. Other AAP chapters are making climate advocacy a part of their legislative agenda, and she would like to do the same in the months to come. Doesn't necessarily mean to do any active lobbying, just to make sure that we make sure to give messages to our legislatures that this is an important topic for pediatric health. So if you're interested in climate advocacy or environmental health, please contact Mara. Next is early hearing detection and intervention, or EHDI. Joe Livingston is our champion, but he is stepping down. I did just want to put a link here to the pediatric audiology services. Alaska is enrolled, and this is a directory of facilities that offer pediatric audiology services. Our contact for the state also is Annette Callies. She's the EHDI program manager. And the EDI goals are to basically ensure that that every child with hearing loss is diagnosed and receives appropriate, timely intervention, and to enhance pediatricians and other healthcare providers' knowledge about the ED 136 guidelines, which is screening at 1 month of age, diagnosis of hearing loss by 3 months of age, and entry into early intervention services by 6 months of age. So we are recruiting a new EDI champion. So if you are interested in serving as a point person for newborn hearing issues at the state and local level, please do let us know. Okay, pros, Jody. Is Jody still on?
There we go. I'm here. Hi. Okay. Pediatric research in the office setting is an opportunity for all pediatricians, usually office-based, but there is the occasional opportunity for hospital-based pediatricians in your regular everyday life, being able to foster a national and participate in research. And there is one on the horizon that is apropos for all the things that we've discussed today. This is the We Care program, and it's a tool to help us screen for unmet needs in the families, to include food insecurity, housing insecurity, employment, parent education, utilities, childcare, other resources, internet, diapers, whatever, finding the things that are lacking in our community, and then learning how to make resource worksheets to share with the families, to provide them with concrete, helpful ways to make an intervention on some of those unmet needs that they have. So to implement, if you get a hold of me at my email, I will forward you the flyer and the study response form, and you can fill it out. And if your practice is interested, not everybody in your practice has to participate. And they are specifically looking for practices that don't require a second IRB, that can use the American Academy of Pediatrics IRB okay without having to go through a second IRB. So if you have, I sent a copy of my letter because that's really all I have because this is brand new, hot off the press, literally. I sent in my my response form yesterday. If you are interested in participating in this, contact me at the email. And then I think I sent you a email with the letter that you can put some of the information and then they can get an idea.
I will look forward to reading that.
Yes. So it's very fun. I love doing prose things.
Okay.
You get
great.
to do science, and I get to brag with my students that come in, or my patients that are students come in, and they tell me about their science project and I tell them about my science project. So it's a lot of fun.
Okay, thanks, Jody. Next, we are recruiting for the CATCH facilitator role, and that's community access to child health. The CATCH mission supports pediatricians to collaborate within their communities to advance the health of all children, and they support innovative pediatrician-led health projects in the initial stages of development and implementation for these community-based initiatives. The grants are up to $1,000 awarded on a competitive basis annually, and the current cycle is open since last month, and the application is online. We've received a CATCH grant for school-based clinic healthcare. Yen Chi got that in Bethel several years ago. And there's basically two grant categories, planning and implementation, and then resident or a fellow grant. And if you are interested or have any passion for like kind of grant planning or want to know more about how to apply for grants, the AAP will train you in this role so that you can help with technical assistance, promotion of the CATCH program, and communications and reporting. So if you're interested, please do let us know. Okay, moving right along to advocacy. The AAP serves as a leading voice in our nation's capital, working to advance federal policies to support, protect, and promote child health. So the Blueprint for Children, the original was in 2016, but the 2020 version was published in advance of Election Day, and it makes clear how much is at stake for children, and it reflects the state of children in 2020 and recommends policies to promote healthy children, support secure families, build strong communities, and reclaim America's role as a leading nation for youth. And building on the blueprint, the Academy recently issued the transition plan, Advancing Child Health in the Biden-Harris administration. This document is quite thorough, and it has like 140 some recommendations in 27 issue areas in these 4 categories. The themes of healthy children, secure families, strong communities, and leading nation. So those resources are on the federal advocacy website of the AAP. As we are awaiting the transition and inauguration day in January, there are some lame duck priorities that were highlighted in the last chapter chat. A national call of the AAP, and that's school funding, expanded PPE, vaccine confidence and infrastructure, provider relief, family supports, financial housing, nutrition and childcare, Medicaid and CHIP funding, and global health. This is one that addresses extending Medicaid for postpartum mothers. We want to go extend that from 60 days to 12 months. So we can write our legislators, and there's templates that we can use from the AAP advocacy site. Some bills noting that were introduced. There was a Community Immunity During COVID-19 Act, which provides funding to state and local public health departments to promote ACIP recommended vaccinations during COVID pandemic. And then the Vaccines Act actually was a bipartisan bill introduced by our esteemed pediatrician and representative in Congress, Kim Schreier. She's a pediatrician in Washington, and this Vaccine Act supports research to better understand vaccine hesitancy and spread public awareness of the importance of vaccinations through a national public awareness campaign. There were many letters to Congress that chapters could sign on to. Again, this one is highlighting you know, the persistent decline in childhood vaccine rates, and urging the passage of legislation to address vaccine hesitancy and confidence. And we joined with other groups to sign on to these letters. We also, you know, Roz had mentioned that the COVID vaccine is now here. However, the Pfizer and Moderna vaccine, the Pfizer only goes down to 16 years of age, while the Moderna is 18 and up. So the AAP is urging that these COVID vaccine trials should begin including children. And this is just a little Twitter feed from the AAP stating on our priority to do this. Again, there's lots of resources on the AAP advocacy website. This is the 6th edition of the advocacy report. There are letters and summaries that you can click on. You can sign up for like the a weekly capital checkup email. And then also there is what was formerly known as the Legislative Conference. Save the date for the 2021 Advocacy Conference. The registration is opening next month. And this year, usually it's done in Washington, D.C., but of course it's going to be virtual early next year. And its conference agenda is going to include distinguished speakers, advocacy skills, and issue sessions, opportunities to learn how to be a strong voice for children. And then you also get the opportunity to virtually meet with your congressional offices to discuss timely health issues. Our chapter has sponsored the registration fee for early career physicians in the past. So if you are interested, do let us know. This is just to show that you know, we talked about the blueprint for children, but because chapters also play a vital role in leading the voice for children's health and well-being on the state level, the AAP does support chapters in developing a state level kind of advocacy priority in the template of the blueprint. So you can customize a state template blueprint for children based on your state. So we're gonna work on doing that this year. This is just another resource for protecting Medicaid and CHIP during budget shortfalls. We know because the pandemic is leading to a crisis in the finances and the economy, but we do need to let our legislatures, our congressmen know that, you know, being uninsured negatively affects children. It impacts our physician payment, access to care, and also impacts our enrollment and eligibility changes. This was just a photo from last year. I wanted to include to show that we did meet with Senator Murkowski, who shares a passion also for some of the children's health issues that we care about, and that you know, this year not only do we want to focus maybe on our state legislators, but also maybe at the municipal level as well, whether that be in person or virtually. There is a new AAP state advocacy director that we look forward to working with. And if Amy Dressel is on the line, I wasn't sure if she was going to make it, but Amy, do you have anything to add?
No, I think you covered everything there, Anna. The only other thing I would say is that the AAP also lobbied to get CARES Act money in the hands of pediatricians as well, because it went out to family practice in general, adult practitioners first, and then the AAP was very good about standing up and saying, hey, we need that too. So I think that was pretty helpful for a lot of people around the state as well. So I just wanted to say that too. So.
Right. And then providing, making sure that, the CARES Act was kind of Medicare heavy, and providing relief, and that we wanted a Medicaid parity too as well. I think there's a new deal for the new stimulus package right now that came through, a $900 billion deal that I can briefly touch on maybe later. Okay, whew, that was a lot of chapter champion updates. Moving right along. Hope you guys are still hanging in there. We're going to talk about our project and activities that are grant funded. We are so lucky to be able to apply for these grant funded projects. And a big one that we submitted this year was the AAP Chapter Telehealth Echo grant. It's a $25,000 grant, and the plan is to develop and launch an ECHO program. And you guys are familiar with ECHO through the UAA. It's the extension for community healthcare outcomes is what the acronym stands for. It's a telementoring program, using kind of a hub and spoke model of the all teach, all learn philosophy. There's been many COVID related topics that UAA has had a platform for. So we will be collaborating with them because they are the trusted source. And the plan is to host 6 to 8 ECHO sessions featuring didactic lectures followed by case presentation and discussion forum. It launches January 19th. And it will be at noon on the first and third Tuesdays to go through the end of April. Our physician leaders are Marna Schwartz and Matt Cerna. We do have a ECHO Hub faculty team that has already been meeting in December to plan these ECHO sessions. So we hope that you will participate so that we can share experiences and best practices and challenges with each other. So I look for more emails to come on that. And if you're interested in becoming a participant or a presenter or a speaker, please do contact Marna or Matt. The other grant that we got was the Finish Line grant. This is a $10,000 grant funded by Georgetown University's Center for Children and Families in collaboration with National AAP. Basically, it's to protect and strengthen children's access to comprehensive care via Medicaid and CHIP during and after, beyond the pandemic. And we're we'll be partnering and communicating with the Alaska Children's Trust, which is the local partner. And project deliverables are state specific and can involve educational webinars for pediatricians, other key stakeholders on issues impacting kids, access to care, public education campaigns to raise awareness of the importance and barriers to comprehensive, timely access and advocacy strategies to ensure access to care during and beyond the pandemic. So if you're interested, please let us know, but we'll be getting that going in the new year. We've already done some social media blasts for best practices for increasing immunization rates with the flu vaccine. The other grant we have is still is kind of hot off the press. We just attended a call about this Project First Line grant, which is a CDC National Training Collaborative for Healthcare Infection Prevention and Control. 48 chapters applied and were awarded. And AAP is collaborating with the CDC to use their infection prevention and control curriculum. Basically, the chapter will disseminate trainings targeted to pediatricians and other physicians, as well as school nurses. These trainings aren't meant to be lengthy. They're supposed to be just short, maybe 10-minute videos that are accessible, concise, and interactive. So regardless of your previous training with infection control, we hope that this will help our frontline healthcare workers kind of gain confidence and boost their foundational knowledge and understanding of infection control in order to implement its principles and protocols. So they just want this to be continuing, into the new year. So watch out for that. And then the last grant is a small e-cigarette grant, $1,000 grant where Dr. Radkoff will be presenting an online program for our chapter membership with the latest and greatest information on e-cigarettes and other vaping devices. We have developed some handouts for parents and teens, such as this one. And that's it for we've got a lot of projects. Now that we are able to get grant funds, we really have our work cut out for ourselves. So next is just updates from the annual leadership forum and the district meeting. These are typically held in person. Usually the president and vice president of each chapter, as well as committee and section and council leaders are flown to AAP headquarters. We basically engage in the resolution process, and resolutions are can be authored by any AAP member, and it gives members an opportunity to provide input on AAP efforts to address important child health initiatives. And these resolutions are advisory to the board of directors, and the board will commit action on these. And then of the total 88 total resolutions that were submitted, 74 were adopted, and then we always vote on the top 10. And the top 10 included number 1, addressing structural racism within healthcare. Number 2, supporting child and youth mental resilience in schools. 3, creation of task force on immunization advocacy and hesitancy. 4, ask all children, adolescents, and their families about racism, discrimination, and bias. 5, developing a pediatric model for value-based payment. 6, prohibit the use of race-based medicine. 7, unmet need of inpatient and outpatient mental health for children. 8, advocate for paid parental leave and mother-baby friendly workplaces. 9, physician burnout must be prevented by change in healthcare delivery systems. And 10, expanding training on psychiatric conditions for general pediatricians. Some of the other agenda items that were discussed were school reopenings, successes and challenges. There were, of course, panel discussion on COVID-19, views from the field, advocacy update, and of course, reports from our AAP CEO and President Mark Del Monte and Sally Goza. The district meeting is usually separate in the summer, and but these were combined virtually this year. You can see that District 8 is quite a large swath of states here, but Alaska is part of District 8, and we usually combined it with another district, but since it was all the districts, we just kind of broke out into breakout sessions. Some of the topics covered were diversity, equity, inclusion, Again, leadership reports from the pediatric trainees, early career physicians, school reopening, state Medicaid policy and health equity, and then District 8 had their Chapter 4 Management Committee election. Okay, this is kind of the home, getting in the home stretch. We love the chapter recognition part. We like to thank our chapter champions again for giving us their updates today, and I want to remind our members that we are still recruiting for an early hearing detection intervention, or EDI champion, an immunization champion, medical home, and early childhood. We have some special achievement awards that we have awarded. So we want to congratulate 3 chapter members, Jeffrey Roten for leadership and assistance to other chapter members and pediatric community to assure access to surgical services for Alaskan children. Dr. Jeffrey Demain for his career-long leadership in the pediatric community, his outstanding clinical service and effective advocacy on environmental issues, and Dr. Jeremy Gittimer for outstanding service in meeting the nephrology needs of Alaska's children almost single-handedly and cheerfully for many years. We want to recognize Lily Liu in her new section leadership role. She will be the chair of the section on neonatal and perinatal medicine. It's not too late to give your nominations for our Friend of Children or Community Service Award and Organization of the Year. Just a reminder that the Friend of Children is a non-health professional who has improved or positively impacted the lives of Alaskan children. The previous winner for last year was Michelle Overstreet. She's the founder and executive director of My House, Matsu, which is a resource center for homeless youth. And the organization of the year for 2019 was AAP, or the Alaska Vaccine Assessment Program, which provides vaccines to all children and uninsured adults. And this has been, AAP has been renewed permanently in perpetuity due to an improved funding structure. So please do put in your nominations for Friend of Children and Organization of the Year. Due to the pandemic, of course, in-person grand rounds has been on hold, but we hope to have future curated sessions, virtual offerings for 2021. We've had at least a couple now for December that are happening, one next week. That will be done by Corey Knoll on kind of student athlete return post-COVID. And then we do want to thank the schedulers in advance who I know are probably brainstorming ways to reinvigorate our PEDS Grand Rounds for 2021. And we always want to give a big thank you to Bruce Chandler for his always very thorough and informative weekly newsletter emails. Just a quick mention that Sally Goza has basically championed the virtual presidency of 2020 as our AAP president. She is finishing up at the end of December. Mark Del Monte is basically the pediatrician's attorney, and he was our interim CEO, and now he is our permanent full CEO. Our incoming president for 2021 is Lee Savio Beers, and our president-elect is Moira Salaji, and she comes into office 2022. You know, usually these elections take place in the fall, but because of the change in timeline for the AAP national elections, this was open kind of late May to June. Just wanted you guys to know to increase the diversity of the board of directors. It was expanded to 10 the 10 district chairs to add 3 new positions so that there's more subspecialist engagement. And so we have a medical subspecialist, a surgical subspecialist, and an at-large member. Okay, I just wanted, I would be remiss if I didn't just mention that as of last December 10th, the pandemic has basically, we've reached 1.6 million plus cumulative child cases that represent about 12.2% of all total cases. And this is an increase of 23% or over 300,000 new child cases over the past 2 weeks. This I pulled from the state, the national database that is put together by the AAP and the Children's Hospital Association, just highlighting Alaska's COVID case data. As of December 10th, we have 25,423 cumulative child cases, and here it captures 0 to 19-year-olds. There are other states that capture like 0 to 16 or 0 to 18, but Alaska does 0 to 9, and that represents 17.8% of total cases, which is probably, I think it's in the top 15 of the country. And a percent of the hospitalizations is kind of at par, less than 2%, 1.8 of total hospitalizations. The cumulative child hospitalizations as from mid-December is 15. Again, just to mention that, the Pfizer and Moderna vaccines don't really go below the teenage age group, but Pfizer has studied the 12 to 15 age group, but it's a small trial population, and it's not enough to be comfortable with the safety data. But hopefully in the next 3 to 4 months, we will start enrolling more children in the lower age groups. The AAP National has done a lot of webinar and town hall series, and it has been really a great resource. They did host a COVID vaccine Q&A last Thursday, and all of these town halls, or even the COVID Echo series, are recorded and archived, so you can listen to them later at your convenience. I just wanted to mention that healthychildren.org has also been, it's powered by pediatricians and trusted by parents, so that is also a great resource. And I'm wondering if our chapter membership would want to do a, Alaska specific town hall. We had done one in an Echo platform format where we surveyed our chapter members on what they were doing in their offices as a response to the coronavirus pandemic. And I'm wondering if, I think what would be in order would be maybe a town hall talking about how we can safely reopen schools. And then I just wanted to mention that, we will be having a new president in January inaugurated. The Electoral College has voted, and we've had the highest voter turnout since 1900. It looks like 64.4% of total eligible voters voted in the 2020 election. And we are excited to be moving forward with the Biden-Harris presidential transition. We know that he is basically filling his cabinet, and I wanted just to highlight that there are 2 pediatricians on the COVID-19 advisory board, Dr. David Kessler and Dr. Julia Morita. And again, this is just for Congress. We do have a pediatrician in the House of Representatives. This is Kim Schreier from the state of Washington. And I'm going to end with a message of hope and unity for 2021. More help is on the way. You know, in the news, there's the bipartisan deal of the $900 billion relief package. So that soon we can see coronavirus in our rearview mirror. So I will end the presentation here, and I want to thank you all for listening today, your chapter membership and engagement. So thank you. Please let us know what else we can do to serve you, our chapter members. Thank you.
And Anna, a correction on that discussion. It's the CME's tomorrow morning, not next week.
Oh gosh, thank you. Thank you. I will mention that. We'll make sure that email goes out. That's right. It's hard for me. Did we stop recording, Dale?
I'm trying to stop recording. There we go. We have stopped the recording.